This recorded review will be going over the study guide for Med-Surg 1, Exam 7. Starting with Chapter 35, the endocrine system. Intake of which nutrients is necessary to produce thyroid hormones? We can see this on page 844. Intake of protein and iodine is needed to synthesize both thyroid hormones. What are the functions of parathormone? We can see this on page 846. Parathormone also acts on bone, causing the release of calcium from the bone into the bloodstream. What does the adrenal medulla secrete? We can also see this on page 846. The adrenal medulla secretes two hormones, epinephrine and norepinephrine. These are known as catecholamines, in response to any stimulation from the sympathetic nervous system. What does the adrenal cortex secrete? We can also see this on page 846. The two major types of hormones secreted by the adrenal cortex are the mineralocorticoids, this is aldosterone, and the glucocorticoids, or cortisol. What structure secretes androgenic hormones? We can also see this on page 846. The adrenal glands also secrete small amounts of androgenic hormones. These have effects similar to those of male and female sex hormones. What is the primary mineralocorticoid and its function? Again, we can see this on page 846. The primary mineralocorticoid is aldosterone. This promotes the conservation of water by acting on the kidney to retain sodium in exchange for potassium. What are the functions of cortisol? And again, page 846. The primary glucocorticoid is cortisol, or hydrocortisone. Cortisol acts to increase glucose levels in the blood. Cortisol also helps to counteract the inflammatory response. Why is the pancreas so unique in the human body? We can see this on page 847. The pancreas is both an endocrine and an exocrine gland. Its endocrine function is to produce the hormones insulin and glucagon. Endocrine gland versus exocrine gland. Difference? Also, we can see this on page 847. An endocrine gland will secrete its hormones directly into the bloodstream, whereas an exocrine gland will secrete through a duct to the target tissues. What is the function of luteinizing hormone? What is a consequence of a low level of this hormone? We're going to go to page 843 for this and look at table 35.1, the principal endocrine glands and their hormones. Check out luteinizing hormone, also known as LH. This can be called interstitial cell stimulating hormone, or ICSH, in males. Principal actions include ovulation, progesterone production in females, and testosterone production in males. What is the consequence of a low level of this hormone?
Easy, but you know what I mean? I can see where you can maneuver around here pretty easily. I don't know, Andre, do you have any other final questions?
An increasing luteinizing hormone level is a factor in the symptoms of menopause experienced by many women. And that's on page 843. What is the fructosamine assay used for? We can see this on page 849. Fructosamine assay is another test to monitor control of glucose over time. The fructosamine assay monitors blood glucose over a shorter time frame than the A1C test because it measures sugar attached to the protein albumin, which has a shorter lifespan than hemoglobin. The fructosamine assay test could be indicated for type 2 diabetes. What medications can interfere with the accuracy of results for a glucose tolerance test? We can see this on page 853 within table 35.3, diagnostic tests for detecting and monitoring diabetes mellitus. Check out glucose tolerance test and look at the description. Phenytoin or Dilantin, birth control pills, diuretics, and glucocorticoids will adversely affect the results, so consult your healthcare provider regarding instruction for these medications. How would the nurse assist the patient when planning a 17 keto steroids or 17 KS test is ordered? So we can also see this within table 35.2 on page 852. And check out the 17 keto steroids or 17 KS test. Then look at the description. You should collect a 24-hour urine specimen. Then check with the laboratory on the need to keep that specimen chilled. Ensure that a space or fridge is available. So the nurse should ensure that a space and fridge is available. How would the nurse interpret a hemoglobin A1C of 5% in a diabetic patient? So we can also see this within table 35.3 on page 853. And look at the hemoglobin A1C. Listed underneath are normal values. A value of 4% to 5.9% of total hemoglobin is the normal range. Good diabetic control is indicated with an A1C of less than 7%. So how would we interpret an A1C of 5% in a diabetic patient? That is phenomenal. What cells secrete insulin? We can see this on page 847. The beta cells are responsible for producing and secreting insulin. What does a thyroid panel test for? Which medication should be withheld before this test for accuracy of results? We can see this on page 849. Abnormalities in the thyroid gland activity are among the most common endocrine disorders. To detect these abnormalities, a group of tests known as a thyroid panel will be performed. A thyroid panel measures TSH, T4, T3, and thyroid antibodies, as well as calcitonin and thyroglobulin. These tests could also be ordered individually. Then, if you look on page 850 within table 35.2 at the serum T4, serum T3, and TSH test, look at the nursing implications. Aspirin, iodine-containing medications, contrast media, and other drugs could affect the result, so check with the laboratory for instructions prior to testing. This is the same for TSH as it is for serum T3 and T4. How does the aging body compensate for decreased production of thyroid hormones? We can see this on page 847. Although thyroid hormone levels may decrease with aging, the body makes up for it by decreasing the rate at which thyroid hormone is broken down. Therefore, resting levels of thyroid hormone are usually normal in older adults. However, thyroid disorders are twice as common in older adults. The amount of hormones secreted by older adults will change, decreasing the individual's ability to adapt to stress and respond to environmental changes. And how does decreased hormone production with aging contribute to a patient's ability to adapt to stress? So I just read that one, also on page 847. Chapter 36, Care of patients with pituitary, thyroid, parathyroid, and adrenal disorders. What is a characteristic sign of DI? After what procedure could this develop? We can see this on page 861. DI, also known as diabetes insipidus, is characterized by the production of copious amounts of dilute urine. Central DI most commonly occurs after trauma or surgery in the area of the pituitary or hypothalamus, and this could be temporary or permanent. What electrolyte imbalance will DI result in if left untreated? We can see this on page 862. If untreated, the patient will demonstrate signs of shock and central nervous system manifestations, progressing from irritability to eventual coma due to hypernatremia and severe dehydration. So hypernatremia is the specific electrolyte imbalance that you're looking for there. Is there a cure for goiter? We can see this on page 864. Although the administration of iodine will not cure the goiter, it will stop the continued enlargement of the gland. So the simple answer to that is no, there is no cure for a goiter. How should iodine preparations be administered to a patient? We can see this on page 865. Iodine preparations should be given well diluted and administered through a straw because they can stain the teeth. What are risk factors for hyperthyroidism?
Oh,
We can see this on page 865. In addition, smoking is a risk factor for developing hyperthyroidism. What are some nursing considerations for the administration of radioactive iodine?
you get the trifecta. Now, I gave that instructor in the kitchen. Hey, so that's an automatic process though, right? Like when we put in their bake your team member, when we're doing the NE sheets, when we're doing the upload, what it is with the, the NE upload, that automatically happens on that end.
We can see this on page 866. Radioactive iodine, also known as ablation therapy, is the definitive treatment for hyperthyroidism. It destroys thyroid tissue. After treatment, all body fluids can be radioactive for a short time. Because the iodine circulates in the blood and is excreted by the kidneys, precautions must be taken when handling needles, syringes, and other equipment likely to be contaminated with blood, and when handling bedpans, urinals, and specimen containers likely to be contaminated with urine.
Oh, okay. Oh no. So you saw when you went the OLC that it was active. Oh,
Describe a subtotal thyroidectomy. We can also see that on page 866. In the subtotal procedure, 2/3 of the glandular mass is removed. The remaining portion of the gland is left intact so the production and release of thyroid hormones can continue. What is an important consideration the patient needs to know when taking methimazole or tapazole?
because usually you don't see anything in the NE. Usually you don't see anything in the NE portal. I mean, Sheila. OLC under the NE number, correct? Because you're doing their education. That's what I find to be true. Okay.
We can see this on page 866. Antithyroid drugs are prescribed as the initial treatment of hyperthyroidism. Methimazole or tapazole is the main drug used. The patient must take the antithyroid drug at the prescribed time and then strictly according to the schedule. Antithyroid medications take a few weeks to work.
So this is the expansion.
How would the nurse support the spouse of a patient starting treatment for hyperthyroidism who is struggling with the emotional outbursts? So we can also see this on page 866. Sometimes it is difficult for the patient's family to accept and cope with the emotional outbursts and mood changes that occur when the disease is not under control. Once hormone levels return to a normal range, the mental and physical symptoms should subside. So the nurse could comfort that family member in reassuring them that antithyroid medications take a few weeks to work. What is an adverse complication after a thyroidectomy that the nurse needs to monitor for? We can see this on page 869. Tetany is muscular twitching and spasms. Tetany results from injury to or accidental removal of the parathyroid glands. Parathyroid hormone is important in regulating body calcium and phosphorus levels, and a deficiency of parathyroid hormone will produce muscle cramps, twitching of the muscles, and in some cases, severe convulsions due to hypocalcemia. These symptoms represent a medical emergency and must be reported to the healthcare provider at once. Essentially, it can induce hypoparathyroidism. So a potential complication after a thyroidectomy is the induction of hypoparathyroidism due to the accidental removal of the parathyroid glands. Is it okay to stop taking levothyroxine when you feel better? No, it is not. We can see this on page 871 within the blue patient teaching box, Self-Care Management of Hypothyroidism. Levothyroxine is lifelong therapy. It should never be stopped by anyone except the practitioner who prescribed it. What are the symptoms of myxedema? We can also see this on page 871 within the blue patient teaching box. Report signs and symptoms of myxedema. This includes dizziness, respiratory distress, low blood sugar, or hypothermia, and hyperthyroidism. Symptoms of that would include weakness, palpitations, agitation, increased urination, thirst, diarrhea, or insomnia. How is Addison's disease treated? Is it okay to miss a dose of medication?
Don't even open it. No, you don't open it.
We can see this on page 874. Prednisone is given to replace glucocorticoids. Fludrocortisone is a synthetic adrenocortical steroid to replace the mineral corticoid aldosterone. These corticosteroids must be taken daily. So it is not okay to miss a dose of the medication. What is a consequence of too much fluid, and how does this affect blood pressure? We can see this on page 876 within the Nursing Care Plan 36.2, Care of a Patient with Adrenocortical Insufficiency. Nursing interventions include administering IV fluids as ordered, monitoring the IV site, lung sounds, and urine output. The selected rationale is that IV fluids will restore fluid volume. During fluid resuscitation, it is important to monitor for fluid overload. So a consequence of too much fluid is fluid overload. How would this affect your blood pressure? It will go up. How does dexamethasone suppression test work? We can see this on page 878. If cortisol is elevated, a dexamethasone suppression test should be ordered. For the test, the patient will be given a steroid at night, and blood and urine cortisol levels will then be measured in the morning. What are some nursing interventions for the patient recovering from SIADH? We can see this on page 864. Closely focus on the cardiovascular and neurologic systems and remain alert to the possibility of fluid shifts. Promptly notify the healthcare provider for any change in level of consciousness. Electrolytes should be monitored closely, as often as several times per day, and daily weights should be measured. Careful monitoring and implementation of ordered fluids and medications are critical to a good outcome. So nursing interventions include monitoring the urine output and assist with ADLs. Also note that a Chvostek sign is a symptom of hypoparathyroidism. Manifests as muscle irritability when the facial nerve is gently tapped. Remember that the Trousseau sign and the Chvostek sign are both symptoms of hypocalcemia that can result with hypoparathyroidism. Chapter 37, Care of Patients with Diabetes and Hypoglycemia. Describe the pathophysiology behind type 1 diabetes mellitus. We can see this on page 883. Type 1 diabetes occurs when the body's immune system destroys insulin-producing beta cells. It is an autoimmune disease. What percentage of diabetic patients are type 2? We can also see this on page 883. Type 2 diabetes makes up 90 to 95% of all known cases of diabetes. So about 95% of all known cases of diabetes are type 2 diabetes. Is gestational diabetes cured with childbirth? No, it is not. We can see this on page 884. After pregnancy, the gestational diabetes condition must be reevaluated because approximately 35 to 60% of women with gestational diabetes will be diagnosed with type 2 diabetes in the years after their delivery. How does stress increase the risk of developing diabetes type 2? We can see this also on page 884. Emotional or physical stress can unmask an inherited predisposition to the disease, probably as a result of glucogenesis induced by increased production of hormones from the adrenal cortex, especially the glucocorticoids. What are two key cornerstones to diabetes treatment that are non-pharmacologic? We can see this on page 884 in the bolded text. With weight reduction and increased physical activity, blood glucose can be restored to normal levels and maintained there, hence the importance of diet and exercise in the management of type 2 diabetes. Describe the action and presence of islet cell antibodies. We can see this on page 884. It is believed that the presence of islet cell antibodies in the blood, which are not present in healthy individuals, will eventually destroy the beta cells and insulin production will cease. What does the American Diabetes Association recommend for diabetes screening? We can see this on page 884. The ADA recommends screening all adults, especially those who are overweight and have one or more additional risk factors for type 2 diabetes. This should start at age 45 years old and be repeated every 3 years. A hemoglobin A1C, fasting plasma glucose, and a 2-hour 75-gram oral glucose tolerance test are the appropriate screening methods. Describe the pathophysiology behind polydipsia in the setting of hyperglycemia. We can see this on page 885. Cellular dehydration causes thirst and a resultant increase intake of water, known as polydipsia. Describe the pathophysiology behind ketosis. We can see this on page 885 as well. The oxidation of fats is incomplete, and fatty acids are converted into ketone bodies and acetone. When the kidney is unable to handle accumulated ketones in the blood, ketosis occurs. What would you expect to see elevated in the labs for a patient with DKA? We can see this on page 894. In the absence of insulin, potassium comes out of the cells and patients will present with hyperkalemia. Describe key signs and symptoms of DKA. We can see this on page 893. In an attempt to rid itself of acidosis produced by the ketones, the body will increase the respiratory rate and depth, known as Kussmaul's respirations. Acetone, a ketone body, will be excreted in the urine, causing acetonuria or ketonuria, and from the lungs, which can be detected in the characteristic fruity odor to the breath. What is a contributing factor to the decreased resistance to infections in the diabetic patient? We can see this on page 885. Another contributing factor to infection and delayed healing may be decreased blood supply to the tissues due to atherosclerotic changes in the blood vessels. What is the goal hemoglobin A1C for diabetic patients? We can see this also on page 885. Research has demonstrated that lowering A1C levels to 6.5% is associated with decreased microvascular complications of diabetes. Why is tight glycemic control not the best option for the 85-year-old diabetic patient? We can see this on page 885 in the red older adult care points. Older adults experience hypoglycemia more quickly than do younger people, and older adults are more prone to hypoglycemic episodes. Older adults may progress to dangerously low levels of blood glucose before signs and symptoms are obvious. Severe hypoglycemia in the older adult can precipitate MI, angina, stroke, or seizures. For this reason, tight control may not be the best plan for older adults. Also on page 885, patients attempting tight control will follow an intensive therapy plan of blood glucose testing multiple times per day, and insulin injections will be delivered or by an insulin pump. There are some risks associated with perfect control of blood glucose levels, and tight control is not indicated for every patient. The most serious control issue is hypoglycemia or insulin reaction. What is the primary goal of a diabetic diet? We can see this on page 885. In many cases, people with type 2 diabetes can control their blood glucose by reducing caloric intake and increasing physical exercise. The primary goal of a diabetic diet is adequate nutrition with weight control. The primary goal of a diabetic diet is adequate nutrition with weight control. And why does diabetes lead to cardiovascular disease? So we can see this on page 895. Elevated blood glucose levels over a period of years will seriously damage blood vessels and the organs they serve. In addition, cardiovascular disease and other causes of death often can be attributed to diabetes. Damage to the mechanisms that control blood vessel health will occur when blood glucose is elevated over a long period of time. The alterations in the macrovascular system result in coronary artery disease, peripheral arterial disease, and stroke. Also note on page 891 that insulin enters the bloodstream at different speeds when given at different sites. The abdomen has the quickest absorption rate, followed by the upper arms. Patients are encouraged to keep a daily record of injection sites to help remember which sites have been used and to prevent the problem of altered or erratic absorption. On page 887, see the patient teaching for home treatment of hypoglycemia. Patients should have an emergency plan and supplies for treating low glucose. When signs of hypoglycemia are present and the patient is able to swallow, give one of the following to provide about 15 to 20 grams of glucose or simple carbohydrates. A half a cup of juice or regular soda, Orajel is also preferred. You should follow up with a longer acting source, like crackers and cheese or a meat sandwich. Peanut butter and graham crackers is also a very good option. Note on page 884 that hyperglycemia increases the concentration of intravascular fluid. This raises osmotic pressure and pulls water from the cells and tissues into the blood, causing cellular dehydration. The kidneys will try to get rid of this extra glucose in the urine, and this is glycosuria. Chapter 18, Drug Therapy for Diabetes. How does insulin work in the body? We can see this on page 328. Insulin is a hormone produced by the area of the pancreas known as the islets of Langerhans and works to regulate the amount of glucose in the blood. Like other hormones, insulin is a key that binds to its cellular receptors, which acts as locks. When insulin binds to its receptors, doors on the cell membranes open, allowing the glucose to enter the cells. This lowers blood glucose level. Glucose in the cells is metabolized to generate the cellular energy needed to maintain maximum cellular and organ function. Define hyperglycemia. We can see this on page 328. Too much blood glucose is hyperglycemia. Describe the function of glucagon. Glucagon prevents low blood glucose levels by triggering the release of glucose from storage sites in the liver and skeletal muscle. Also see on page 328 in the orange memory jogger box. Insulin is the hormone of plenty, which is released when blood glucose levels are above normal. Its function is to lower blood glucose levels and prevent hyperglycemia. Glucagon is the hormone of starvation. This is released when blood glucose levels are lower than normal. Its function is to raise blood glucose levels and prevent hypoglycemia. Why does a type 1 diabetic patient require insulin? We can see this on page 329. With diabetes mellitus type 1, the pancreas produces no insulin. What are insulin? Oh, I skipped one. Do type 2 diabetics use insulin? We can see this on page 330. Although insulin may be necessary for some patients with diabetes type 2, diet, weight reduction, and non-insulin anti-diabetic drugs are often effective in maintaining good glycemic control. So short answer to that is yes, type 2 diabetics can use insulin, although we try to avoid it as much as possible. What are insulin stimulators and how do they work? We can see this on page 330. Insulin stimulators are oral, non-insulin anti-diabetic drugs that lower blood glucose levels by stimulating the release of insulin stored in the beta cells of the pancreas. The patient must have some functioning beta cells for these drugs to work. How should glipizide be taken? We can see this on page 331 in table 18.2, examples of insulin stimulators and biguanides. Check out glipizide under insulin stimulators and look at the nursing implications. Instruct patients to take these drugs with or just before a meal to prevent hypoglycemia. What class of medications does metformin belong to? Metformin belongs to the class biguanides. It is actually the only medication within this class. You can see this on page 331 within table 18.2. For which patients is metformin contraindicated? We can see this on page 332. Assess the patient's kidney function. Metformin should not be given to patients with kidney disease because it can cause kidney failure. Should a patient be instructed to take their metformin the morning they are scheduled for a procedure with radioactive dye? No, definitely not. We can see this on page 332. Metformin should be stopped at least 24 hours before any test that uses radioactive dye and should not be started again until 48 hours after that test has been completed. You can also see this in the purple top tips for safety on page 332. Why should a patient taking rosiglitazone monitor their weight daily? We can see this on page 333 within table 18.3, examples of insulin sensitizers and alpha glucosidase inhibitors. Look at the insulin sensitizers, also known as thiazolidinediones or TZDs. Rosiglitazone or Avandia, and nursing implications. You should monitor patients carefully for signs and symptoms of heart failure. Examples of symptoms would be excessive and rapid weight gain, dyspnea, and edema. So why should the patients monitor their weight daily? Because they are more at risk for heart failure when taking that drug. What beverage should patients taking medications in the thiazolidinedione class avoid? So the TZDs. So these patients should avoid drinking alcohol while taking this drug because alcohol can affect blood glucose levels, causing hypoglycemia or hyperglycemia, depending on the amount of alcohol ingested. And you can see that on page 334. How do alpha glucosidase inhibitors work? Give an example of a drug in this class. We can see this on page 333 within table 18.3. Alpha glucosidase inhibitors are non-insulin anti-diabetic drugs that lower blood glucose levels by preventing enzymes in the intestinal tract from breaking down starches and more complex sugars into glucose. An example of a drug in this class is acarbose, also listed in that table. How do oral anti-diabetic drugs affect oral contraceptives? We can see this on page 331 in the purple top tip for safety. Sulfonylureas can decrease the effectiveness of certain contraceptive drugs. Women of childbearing years who are taking this anti-diabetic drug will need an alternative contraceptive method to avoid pregnancy. Describe signs and symptoms of hypoglycemia. We can see this on page 331 within the orange memory jogger box. Indications of hypoglycemia. This would include a headache, hunger sensation, difficulty concentrating, nervousness, tremors, increased sweating, pale clammy skin, rapid heart rate, anxiety, and confusion. Why is insulin a high alert drug? We can see this on page 340 in the purple top tip for safety. Insulin is a high alert drug that can cause great harm when it is given at too high or too low a dose, is not given to a patient for whom it was prescribed, or if it's given to someone who does not have diabetes. If insulin is given at too high a dose or is given to a patient without diabetes, the patient could become severely hypoglycemic with the risk of death. If insulin is given at too low a dose, the patient's blood glucose level will be poorly controlled, increasing the risk of severe hyperglycemia, ketoacidosis, and death. What is the onset of short-acting insulin, and when should patients be instructed to eat? We can see this on page 342. This will be within table 18.6, timed activity of pharmaceutical insulin. Notice that short-acting insulin has an onset of 0.5 hours or 30 minutes. So patients taking A short-acting insulin should eat a meal 15 minutes within giving themselves a dose. Patients should eat a meal within 15 minutes of giving themselves a dose of short-acting insulin.